New tattoo aftercare for infection prevention. Fresh tattoo design. New tattoo aftercare. Sure, your new intricate tribal tattoos look great and are reeling in tons of compliments, but what if they suddenly get infected and bulge up? It will not be a pretty picture. Remember, a tattoo isn't complete until it is completely healed. So read on. Take the following advice to heart. New tattoo aftercare. Let your tattoo breathe. A new tattoo is just like a cut. Your skin has been scarred. Like any wound, your tattoo needs to breathe. If the artist covered your fresh tattoo with sarin wrap or any plastic that keeps air out, remove it. This is very harmful to both your tattoo and your body. A good bandage that allows air to circulate and penetrate through is what should cover your new ink, especially if you have chosen complex designs like Polynesian tribal art and intricate flower peacock feather tattoos. New tattoo aftercare. Remove the bandage. Don't leave your tattoo bandage on for too long though, about 2 or 3 hours should be enough. When you remove the bandages, try to be in a clean environment so you don't catch any unnecessary germs. Avoid dusty places and do not be in a fly or insect-infested area. New tattoo aftercare. Wash, clean, and dress. Once the bandages are off, do not scrub your tattoo. Using a mild antibacterial soap and warm water, gently wash the tattooed area with your fingertips or hands. Remove any excess ink, ointment, and blood to avoid scabbing. If your tattoo feels slippery or slimy, it is probably because of the plasma seeping out, so wash this off too. If your symbol is big and hard to reach, you can remove the bandage and take a warm shower, but let the water run over your tattoo indirectly. Do not make the full shower force hit your fresh wound. Be very careful. Ask someone to help you if possible. Gently blot your tattoo dry with a clean soft cloth, or just air dry it. After washing, work in a thin coat of ointment like tattoo goo, vitamin E oil or A&D ointment. Put just enough to keep your skin moist. If it gets runny or liquefies, then you put too much, and you should dab off excess ointment with a clean paper towel. In the next 2 weeks, you are not to brush or wipe the tattoo with a washcloth or anything rough. New tattoo aftercare. Caring for a week-old tattoo. The first week after you get your new tattoo, cleaning is very important. You do not have to re-bandage your tattoo once you take the initial one off. The simple rule is, clean your tattoo. Wash your new tattoo at least once or twice a day to keep away infection. Apply ointment whenever the symbol starts feeling stiff, but don't put too much. Doing this will avoid the formation of thick hard scabs that may crack as you move. Remember the delicate peacock feather tattoos we were talking about yesterday? It will turn into a blurry mess if you let the scabs form without care. So you have to determine yourself how much, or how little, moisture ointment to apply, because skin types differ. If the right amount of moisturizer is there, a thin protective layer will form on the tattoo. This layer will eventually peel off like dead skin on a sunburn, so don't panic. If you see thin flakes of colored skin are falling off, it is usual in the healing process. New tattoo aftercare. Things to avoid. There are of course other precautions that must take. First, do not peel or poke or pick your tattoo and healing skin. Keep your showers under 10 minutes and keep away from the ocean, swimming pools, hot tubs, saunas, and jacuzzis. When you take a shower, apply a layer of Vaseline on your tattoo so it won't get soaking wet. Forget lingering out in the sun for too long or exposing your tattoo to excess heat. Do not shave or scratch over your tattoo. You should also avoid contact sports as well as skin-to-skin contact with other people and with animals. Try your best to stay in clean, dry places. No matter what tattoo you get, a simple star outline, an elaborate feather tattoo or a colorful cartoon, let the ink settle and let your wound heal out. If despite all these precautions you still manage to get an infection, irritation or allergic reaction, see your doctor for professional advice.